Yuma County is located in the southwest corner of Arizona. We have a shared border with Mexico to the south. One of the challenges that we faced early on in the pandemic was the fact that we had people going back and forth through the border every day to come to work.
When we all started this, we had no vaccine. We are next to the border. There's always a concern that we have some way to mitigate the rate of infection, but there's a lot of people that cross, essential workers that cross and actually work here, but they also purchase here, and they also have family here. And we depend on these people to cross every day. So it was a challenge. I've been the mayor for San Luis for almost 10 years now, but also a provider. Having that dual position puts me in a position where I can make a difference, not only when treating my patients, but also making sure they don't get sick.
COVID was happening so fast, so quickly that nobody knew anything. It was just a scary moment where everybody were told to go and shelter in place. And our population couldn't do that because they're essential workers. They had to be working.
We really wanted to partner with people that had established roots and had those relationships in the community. As healthcare providers in the Public Health Authority, we had those relationships, but COVID came at a time where there was lots of distrust in the government. We learned early on in order to address some of this was that we really had to reach out to the local communities and especially our nonprofit partners, our elected officials, and work together with them.
Some of the challenges that we saw immediately once the pandemic started is accessibility and education. Our elder population did not have access to internet, or it was difficult for them to get through a phone call to make an appointment. So that's when we immediately acted as a community-based organization, and we came and communicated with the Yuma County Health Department, where we established this partnership where we started holding vaccination clinics here at our local community.
We had decided to maintain ourselves really a community grassroots organization and being able to meet the needs of that population that very often is not known by the organizations or the governmental entities that develop the programs. Usually our population is not the one they have in focus when they're developing the services. We try to not just provide the services, but also be like a voice, an advocate organization that leaves their voices to those that need to hear them.
It was really challenging for us to make sure that not only were we able to provide accurate information, but that it was timely and that it was presented in a manner that was culturally appropriate. And because we share that border, it also entailed having partnerships with our health officials across the border, which is the Secretaría de Salud, so that we were presenting information along the border region that was consistent, that was accurate, and that was relatable to them.
So that's when we began reaching out to our local public health entities, and they were readily available and willing to help us.
Our local organizations and nonprofits have been the right match for the health department and COVID response. They've been supportive on making sure that there's one concise message to go out into the community. I feel like the health department became mobile so that we can address the immediate needs instead of waiting for the community to come to us. We went to them.
Our paramedic students, our law enforcement students helped direct traffic, our social work students helped translate. So it was a true effort, and it gave those students an opportunity to get some hands-on learning, and hopefully will be a very unique experience.
I think this is an example of how Yuma County Health Department is so essential. While everyone else is making it political, we were not making it political. It was about our residents, about keeping everyone healthy. It's about keeping the numbers down in the hospital. It's about having the proper number of ventilators available at all times. Yuma County as a whole, I think we did very good. I'm just very proud of our community.